Okay, we'll continue looking at specialists. So, this group focuses on the male and female reproductive systems, also pregnancy, and the specialized care that is required for newborns. So, these specialists provide care to the mother and fetus throughout pregnancy and labor, as well as during the postpartum period. So, we'll start with gynecologists. Gyneco means female, and gynecologists are going to diagnose, treat, manage, and play a role in the prevention of diseases and disorders related to the female reproductive system. They can perform Pap tests to test for abnormal cells of the cervix, investigate the potential of other abnormalities of the uterus and the ovaries, disorders like or diseases like endometriosis or polycystic ovarian syndrome. Gynecologists will work in either outpatient clinics or in the gynecology unit of hospitals because many reproductive conditions may require closer monitoring or medical management, in addition to those that require surgery, such as a hysterectomy, as we've seen before, and post-surgical recovery. So patients may be admitted to the inpatient gynecology unit because they may have more severe conditions like severe bleeding, pelvic infections, or simply recovery after procedures like a hysterectomy. So they will also work in the operating room as well, involved in surgeries relating to the female reproductive system. Procedures can range from being minimally invasive or laparoscopic to major abdominal surgery. Now, the distinction between a gynecologist and an obstetrician, obstetro means midwife. So obstetricians provide care to the mother and fetus through pregnancy and labor. So they're a little bit more specific or specialized to the process of pregnancy and childbirth, as well as to the mother during the postpartum period, so after birth. You may have heard of the term OBGYN. So OB referring to obstetrician, GYN gynecologist. So this is a common abbreviation that is just combining both obstetrics and gynecology. So it just means directly obstetrics and gynecology. So obstetricians will work in labor and delivery. Childbirth will require continuous both maternal and fetal, so the fetus, monitoring. So this unit is equipped for rapid response if complications during pregnancy or with the fetus arise. They'll use the operating room when a cesarean section or a C-section is required to for the baby, to deliver the baby, and emergency intervention is possibly needed during a pregnancy, then the operating room will be used. They will oversee care in the postpartum unit after birth. So after birth, mothers will require monitoring for things like bleeding, blood pressure changes, and recovery after delivery. So education and even newborn care support will also occur here in the postpartum unit. So again, labor and delivery is where the baby will be delivered. And postpartum unit is where the mother and baby will go afterwards, where they will be monitored and also educated and provided support. So these units are really designed around the stages of pregnancy, right? So labor, delivery, and also recovery. Now, obstetric care often extends into neonatal care. So if a newborn is premature or medically unstable, they will be referred to the neonatal intensive care unit, so the NICU. This may be if a baby is born, again, severely premature and their lungs or other organs have not fully developed yet, they can receive the proper care for this in the NICU. This can include temperature regulation in the NICU if a baby is born prematurely. Advanced respiratory support may be needed as well to help the baby with breathing if their lungs aren't fully developed. So this continuous monitoring and close care will occur in the NICU. Also, it's sometimes referred to as the NICU. Now, urologists, you're referring to urine, work in the urology unit, where urinary conditions may require specialized monitoring. So, for example, after kidney stone removal or after prostate surgery. So, urologists are involved in the diagnosis and treatment of disorders that are related to the male urinary system or the urinary system, and also the male reproductive system. So, relating to the prostate and bladder are very closely associated anatomically. So urologists will use the operating room as well. So if there's surgical correction that's necessary, minimally invasive procedures can often be common. So again, as we're seeing, hospital units are organized around patient needs. So monitoring level, surgical recovery, specialty-specific equipment. So the urology unit is going to have specific, things like urinary catheters, equipment for monitoring kidney function. So the particular unit is equipped appropriately for that specific array of conditions that it is going to treat. Now, an internal medicine physician, also referred to as an internist, specializes in the prevention, diagnosis, and treatment of mainly adult medical conditions. So they're an adult medicine specialist, and they will manage a wide range of more complex and also multi-system diseases and chronic illnesses. So when there is a combination of various diseases or disorders involving multiple systems in the body, particularly diseases that are chronic, this can include things like hypertension, diabetes. Diabetes is associated with a slew of either direct complications caused by the diabetes or is associated with things like hypertension. Also, heart disease, respiratory disorders. Internal medicine physicians will be involved in treatment of complications associated with autoimmune conditions. So they're trained to handle patients with multiple coexisting conditions or conditions that are associated with many other conditions as well. So they often coordinate care amongst specialists. They will typically work in hospital inpatient units. So the medicine unit or general medicine unit provides care for a vast array of illnesses, and they often will treat patients with pathologies such as pneumonia, again, mobility issues, individuals with multiple complex cases. So diabetics who have uncontrolled diabetes but also have heart disease, or have uncontrolled high blood pressure, and so many things happening at the same time. The medical surgical unit, or just like a general medicine floor, basically, again, just a particular unit in the hospital that is going to treat individuals with a wide range of conditions for the coordination of specialist care. Now, this slide focuses on specialists who manage the digestive and urinary systems specifically, but just other system level specialties. So first we have gastroenterologist. We've seen this term before, and a gastroenterologist is going to diagnose and treat conditions that are affecting the digestive tract. So this will include esophagus, stomach, intestines, and also the accessory organs of the digestive system. So the liver, the pancreas, the gallbladder. They manage things like GERD or gastroesophageal reflux disease or acid reflux, inflammatory bowel disease, any bleeds that are found within the gastrointestinal system. So a stomach bleed, for example. They'll be involved in the care of things like pancreatitis, so inflammation of the pancreas, and they can perform procedures like an endoscopy, so viewing of the stomach or the intestines using a scope, a colonoscopy, so viewing the colon, and they also are able to perform biopsies. So if a polyp is discovered in the colon, for example, they can remove it and send it off for biopsy to be tested to determine if it's malignant. They will work in units like the endoscopy unit. So this is where minimally invasive diagnostic procedures like colonoscopies will occur, in addition to in the gastroenterology unit. So the medical gastroenterology unit is going to have patients with things like severe flare-ups from Crohn's disease. GI bleeding may require inpatient monitoring. And they will work closely, even or maybe if needed, in the operating room, like if complications occur from a bowel perforation, so the tearing of the bowel, surgical teams may become involved. The urologists, again, we had it on a previous slide with reproductive because they're largely involved in treating the male reproductive system, but urologists will be involved, as we mentioned, in the treatment of disorders of the urinary tract in both males and females, in addition to the male reproductive system. So they will manage things like, again, kidney stones, but also urinary obstruction, so obstruction of any of the tubules of the urinary system, bladder disorders. They can perform cystoscopies, so to view the bladder, prostate surgeries, and again, they'll work in the urology unit or in the OR as well. Now, a nephrologist is specific to the kidney. So they specialize in kidney function and the medical management of kidney disease. This can include treating chronic kidney disease, acute kidney injury. So this can occur due to toxicity, due to trauma to the kidneys as well. They'll also treat electrolyte imbalances, hypertension or high blood pressure that's related to kidney dysfunction. So the kidneys are largely responsible for regulating blood pressure and the concentration of specific ions in the blood, as the kidneys are responsible for filtering the blood. And so hypertension and blood pressure is very closely associated with kidney function. They will work in the nephrology unit, so for inpatient monitoring of things like kidney failure or severe electrolyte disturbances. They will be found in the dialysis or renal unit for patients that require hemodialysis due to kidney failure. And in severe cases, they may be found in the ICU, for example, for critically ill patients with kidney failure who might require more intensive monitoring. Okay, so for neurology and psychiatry, we'll distinguish the two and their different scopes of practice. So a neurologist will specialize in diagnosing and managing disorders of the nervous system, so including the brain, spinal cord, and the peripheral nerves. They'll treat conditions like epilepsy, multiple sclerosis, Parkinson's, so diseases relating to the nervous system, as well as migraines or chronic migraine disorder, in addition to stroke. So neurologists will focus on medical management, non-surgical, of neurological disorders. They can work in hospitals, in outpatient specialty clinics, in stroke units, or commonly also too, as with any specialist, in academic or research centers. And they play a big role in diagnosing complex neurological conditions. A neurosurgeon will specifically perform surgeries affecting the spine, brain, and nervous system. So things like brain tumor excision, spinal disc herniation surgery, surgery required after a traumatic brain injury or an aneurysm. So they will work in hospitals, surgical centers, trauma centers as well. And the distinction with a psychiatrist is that a psychiatrist is a medical doctor who specializes in mental health disorders. So conditions like depression, anxiety, bipolar disorder, schizophrenia, other psychiatric illnesses. So the distinction between a psychiatrist and a psychologist is that psychiatrists are medical doctors and can prescribe medication as part of treatment. So psychologists are more involved in the study of mental health disorders and can also be included in the treatment of individuals with mental health disorders in the form of providing therapy. So psychiatrists will work in hospitals, inpatient psychiatric units, outpatient mental health clinics. They can even have a private practice, or they can work in community mental health centers. So a wide range of settings for psychiatrists to work in. Now, there are various specialists who work in the field of cancer specifically in various roles. These individuals will interact with patients who have been diagnosed with some form of cancer. And when we think about cancer care, it's not managed by one physician, but it's a really coordinated effort across multiple specialists, with each playing a distinct role. So first we have oncologists. We know that onco refers to tumor. So an oncologist is a physician who will treat cancer using systemic therapies such as chemotherapy. They may also use immunotherapy, so directly kind of translating to immune therapy, so therapies that influence the immune system. Hormone therapy can be involved, but they're going to treat patients who have cancer and malignancies in really any area of the body. They will work in medical oncology units. They can even work in outpatient chemotherapy infusion units, and inpatient oncology floors. So this can be inpatient or outpatient. Palliative care may also be largely involved in cancer treatment. Palliative care refers to care that is provided when an individual is in the end of life stage. So a patient becomes palliative when there is no further treatment that is going to occur, and therefore the focus shifts to keeping the patient comfortable and minimizing pain and discomfort as much as possible. Now, a radiation oncologist is a specialist that uses high energy radiation to target and destroy cancer cells, such as that makes up a malignant tumor. So radiation therapy may be used alone, or it could be used alongside surgery and chemotherapy. So it is a very collective treatment for complex disease such as cancer. Then we have the pathologist. Again, the pathologists don't typically see the patient directly, but they're involved in the diagnosis, and they're going to examine a biopsy, even examine blood if we're thinking of blood-specific cancers, and tissues under a microscope to determine the exact type and characteristic of cancer. For pathologists, they'll work in hospital laboratories, diagnostic pathology departments as well. And finally, radiologists, they're going to interpret those images, as we've discussed, to detect tumors, even monitor treatment responses, and assess disease progression. So assess whether a tumor is growing or if treatment is successfully stopping or eliminating the tumor. So again, oncology units, palliative care, and surgery units will be involved if surgical interventions are necessary to eliminate a tumor, for example. Okay, so based on the specialists that we've now seen in the last few slides, I have another case here. So a 29-year-old presents to their primary care physician with abnormal menstrual bleeding and severe pelvic pain. Ultrasound confirms a mass on the ovary, and a biopsy confirms malignancy. So treatment, including surgical and non-surgical approaches, leads patient into remission. So what specialist would be involved? Well, we see that the primary care physician is involved in response to the abnormal menstrual bleeding and severe pelvic pain. The primary care physician likely would have referred the patient to a gynecologist. And from there, when imaging was done and assessed by the radiologist, once the mass on the ovary was detected, oncology would then be involved. And so the pathologist would examine a biopsy to confirm that malignancy of the tumor. So pathologist would be involved there, and the treatment phase would include oncology. So a surgeon, this could be a general surgeon possibly, or a gynecologic oncologist surgeon. So to remove the tumor from the ovary. Oncology specific nurses would be involved in the patient's care. For the actual surgery itself, anesthesiologists may be needed to provide sedating medications. Now, treatment, again, including surgical and non-surgical. So in terms of non-surgical approaches, this may have involved radiation. In that case, a radiation oncologist would be involved as well. Now, afterwards, we see here that the patient is led into remission. And so it's important to note and remember that care for the patient, especially in cases of cancer remission, will be ongoing. And so supportive care, such as, seeing in this case, maybe a fertility specialist if fertility preservation was discussed, psychologists or mental health professionals, pain management will be involved, whether that's, with the family physician going forward, or even a pain specialist. Physical therapy, possibly post-surgically, if needed. So we can see that it is a very holistic and involved process with many healthcare providers. In terms of hospital units, we will, outpatient primary care offices, gynecology clinics, oncology clinics, the pathology lab, imaging departments, operating room, recovery room. Now, treatment units for oncology, that oncology infusion unit for chemotherapy, possibly day surgery if outpatient procedures occurred. And for recovery, likely, gynecology follow-up, oncology follow-up clinics. So very, very comprehensive and holistic approach here for treating. Okay, there are specific specialists for musculoskeletal injuries or disorders or diseases. So an orthopedist, ortho means straight and peen actually means child. So this term comes from this kind of origin, but an orthopedist will just treat general bone, joint, and muscle disorders. The name just comes from the fact that this position originally only provided care for children who had limbs that were not straight. So that's where the name comes from, but the name of the specialty has not changed, but now all ages are seen and treated for any disorders treating the bones, joints, and muscles. Now, within this, we have, again, the orthopedist. So they're going to treat more general conditions, managing things like fractures, even arthritis, sports injuries, degenerative joint conditions. But an orthopedic surgeon is going to complete additional specialized training in order to perform surgery for diseases related to the musculoskeletal system or injuries. So an orthopedic surgeon can perform operations such as fracture repairs, joint replacements, even spinal surgeries. So a wide array of surgical repairs of the musculoskeletal system. A rheumatologist is a little bit different. So they treat systemic diseases that affect joints and muscles. So this includes autoimmune disorders that may affect multiple body systems. So rheumat means flow, historically referring to flowing pain. Rheumatologists will specialize again in the systemic, autoimmune, and inflammatory joint disease, such as rheumatoid arthritis, lupus. So these particular disorders are going to infect many systems in the body and cause inflammation throughout the body, but also affect things like the joints. Now, unlike orthopedic surgeons, our rheumatologists focus on medical management, so using medications to control inflammation and prevent joint damage rather than actually performing surgery. So together, these specialists will often collaborate very closely, especially in complex cases where both surgery and medical management are needed. Now, when we move to specialists who focus on sensory organs and the skin or the integumentary system, we can see a group here of very highly focused physicians. So derm means skin. A dermatologist is going to treat any disorders affecting skin, hair, and nails, eczema, acne, psoriasis, skin infections, and including skin cancers. Treatment may include medications, minor procedures. They can even perform the surgical removal of lesions. They will typically work in outpatient clinics, private practices, and even hospital dermatology departments. An ophthalmologist, ophthalmo means eye. They are medical doctors who provide medical and surgical management of eye conditions, such as glaucoma, cataracts, infections, and vision-related diseases. Glaucoma is an example of a vision-related disease affecting the pressure within the eye, and they can perform eye surgeries as well. They'll work in hospitals, surgical centers, and even specialized eye clinics exist that involve this treatment. And finally, the otorhinolaryngologist, which you can refer to as an ENT, as most people refer to as an ENT. And we'll break down this word actually. So auto meaning the ear, rhino meaning nose, laryngo meaning throat, and we have ologist. So they are going to treat conditions involving hearing, the nose or sinus disorders, including tonsils, and throat. So tonsils, vocal cords, balance issues, even related to the inner ear and balance, and also head and neck concerns. And they can also perform surgical procedures as well. They'll work in hospitals, surgical centers, as well as outpatient ENT clinics. Now, other units here, so a burn unit, dermatologists may work closely in a burn unit for an individual who has experienced severe burns to the skin, operating room, or even day surgery for more minor procedures. But mainly these individuals largely work in outpatient departments or clinics, but may also appear in specific hospital units as well. Okay, so both of these specialists, endocrine and immune, focus on complex regulatory systems within the body. So systems that affect, nearly every organ and often will require long-term management. Now, first here is clinical immunologists and allergists. So these physicians will diagnose and treat disorders of the immune system, allergies, asthma, autoimmune diseases. So they help manage conditions where the immune system is maybe overactive or underactive, or even misdirected in the case of autoimmune diseases, where the immune system is attacking the body And so the immune response is misdirected to normal tissues, causing inflammation. They'll typically work in outpatient specialty clinics, but also can work in hospitals and academic or research centers as well. Endocrinologists, meaning secrete within, will be individuals who treat endocrine system disorders. So glands secreting hormones internally into the bloodstream. This can include conditions like diabetes. So insulin is a hormone that regulates our blood sugar levels, thyroid disorders, adrenal gland disorders, and any hormonal imbalances. So they'll work in hospitals, outpatient clinics, diabetes care centers, and specialty endocrine practices as well. An infectious disease specialist, and you may recognize this individual as they played a very big role in information regarding the pandemic. So an infectious disease specialist is a physician who has additional training in infectious diseases. So they can assist with diagnosis, treatment, and also population-specific aspects of illnesses or viruses, and ways of decreasing the spread of an illness in the population. So I've created this matching opportunity. So I've listed the various specialists here and also a given condition. And the task is to, assign each doctor or specialist to the condition that they would be responsible for treating. So for the purposes of time, I'm going to challenge you to perform this on your own. And I, in a separate document, will post like the lines showing the connection points between each. So I encourage you to practice this particular task as an activity.